Hello everyone and welcome back to Medexplain, a YouTube channel dedicated to teaching medicine. Today we will be starting the first of our Pharmacology series. During medical school, you will have to learn a lot of medicinal drugs, details on how they work, their side effects, when to prescribe, but also, more importantly, when not to prescribe them. This can be a lot of information, and so this video is designed to introduce you to an effective method to learn your pharmacology efficiently and to ensure you're hitting all those key points. The method used in this video will form the basis of our next pharmacology videos, where we will go into details about specific drugs. So, without further ado, the best technique I have found to learn drugs is to mistime them. Mistime is an acronym which covers all the fields of pharmacology that we need to know. Let's go through what mistime stands for. The letter M represents the mechanism or mode of action. This means how the drug works on a cellular level to achieve its intended effect. The mechanism of action of a drug also looks at the pharmacokinetics, which involves details on how the drug is administered, absorbed, distributed throughout the body, how the drug is metabolized, and finally excreted from the body. This is very important to know, as it will also highlight and help you to understand the physiology of why some drugs will cause some of their unwanted side effects, or why we may not be able to give the drug to particular patients. For example, broadly speaking, in a patient whose liver is not working very well, for example in liver cirrhosis, drugs which would otherwise have been metabolized by the liver will no longer be broken down and thus accumulate to toxic amounts in the body. An example of this is ibuprofen, which is metabolized by the liver and thus should be avoided in patients with liver cirrhosis. The letter I of mistime represents the indication of the drug. Why is it given, and what is it used to treat? For example, opioids such as morphine sulfate will have the indication of pain relief. The S of mistime stands for side effects, which are important to learn for all drugs. T represents therapeutic evaluation, which refers to additional information about the drug, about when to stop, start, or withhold the medicine, for example, in pregnancy or in breastfeeding mothers. The I means interactions that this drug will have with other drugs, and thus any changes you may need to make with their medications. The M stands for monitoring of the drug. For example, are there any tests that the patient should take before, during, or after administering the medication? And finally, E of mistime represents education. What information does the patient need to know? For example, information on the timing of administrations, changes of medication in the event of illness, diet changes and use with alcohol, as well as signs and symptoms to look out for in the event that this medication will need to be stopped. With mistime, you can be sure to learn everything there is about each and every drug. We will now mistime some drugs on this channel in the next video of our pharmacology series. I hope you found this video useful and learnt the building blocks of our pharmacology journey. As always, this has been Medexplain. Please be sure to hit that like button, leave a comment and subscribe, and I'll see you in the next video.